Here to announce that the Knoxville Police Department and City of Knoxville, our number one concern is the public safety of the people of this community. And because of that reason, we want to encourage everyone who can be tested to be tested, and that they do not have to have any concerns about their information being shared with anybody but people in the public health community. There was an opportunity to share that information with law enforcement, and I have great confidence in our Knoxville Police Department, and there were safeguards in place that would have made sure that the information was used in appropriate manners and not just to protect our first responders. But there are better ways to do that, and we are actively working to make sure our first responders have enough personal protective equipment, masks, and other things to protect themselves and the community they serve. But first and foremost, we want to make sure everyone in our community feels comfortable and safe in getting a test for COVID-19, because the more people we test and the more frequently the test, the more we can have confidence that we're not infected and we can proceed accordingly. But I encourage everyone to wear face masks when they're out in public and can't be socially distant from people, and to continue to follow the guidelines that our experts in the Knox County Health Department set forth. So I'm going to introduce some of the people who are here today to support this decision. First and foremost, our Chief of Police, Eve Thomas. Thank you for being here. Obviously, Cynthia Finch is a clinician and community member who in the medical community. Vice Mayor Gwen McKenzie. Reverend Dr. Joseph Smith from Friendship Missionary Baptist in the Lonsdale community, and of course our own Dr. Charles Lomax, who's the director of the city's Community Empowerment Department and also a minister himself. And one of the reasons we invited the Reverend Dr. Smith here is because we're having a testing event, a free public testing event in Lonsdale on Thursday. And he and some other members of the community contacted me, and we had some conversations, and we wanted to make sure everyone felt confident that they could get tested and have their information, and privacy protected. So that and continuing to make sure we have appropriate safeguards for our first responders are our top priorities. So with that, I will turn to answer any questions, see if you have questions for me, any of the members of the community behind me, and of course our Chief of Police. She's here to field any questions you may have. Yeah.
You mentioned first off that you want to make sure that people get tested. Was there any doubt that moving forward with the MOU would maybe prevent people from getting tested?
Well, it certainly wouldn't prevent people from getting tested, because our health department is doing everything they can to get people tested. Basically, feedback from the community was that some people, it might have been misinterpreted or made them fear that the information was being shared for law enforcement purposes, which it wasn't. The only intention behind that MOU, as far as I am understanding, is to protect our first responders. But in some ways, it was going to be a false sense of security, because we've done a good job with testing and it's getting better, but we still very, very few people have been tested. Raise your hand if you've been tested. That's one. And this is a very connected group of people. So I think in our community, we've tested more people than ever before, but most people have not been tested. And there's a lot of evidence that people can be infectious and asymptomatic. And so the best thing is for our first responders, our police officers, our firefighters, our EMTs, as well as just members of the general public, to assume that people are infected. And that's why we wash our hands a lot. That's why we wear a face mask when we can't be socially distant. And just take those precautions that the Knox County Health Department is suggesting.
And how much input did you get from the public in making this decision?
Well, I talked to my police chief, Chief Thomas, and I talked about it quite a bit. I talked to the people in my cabinet and people in the community. So it's a team effort, and I think it's important to listen to the community and also respond to their concerns, even if we think those concerns might not be. Sometimes it's based on perception, not reality. But perception is reality, and it's just so important that people have the utmost confidence in our public health system, and that they don't hesitate to get treatment, and that they don't hesitate to get tested, and that they follow the directives of the health department if they do test positive and stay quarantined.
For clarity, for simplicity, the MOU that came out that was talked about yesterday is no longer in force.
That's correct. It was something that came out of the state of Tennessee, and there was some initial interest in it, but after further discussion and deliberation, we thought the downsides outweighed the upsides. So it is no longer in effect as of today.
And this is a pretty big decision. I know the state was reporting 90 out of 100 departments were utilizing that. Were you aware of that? How many other departments were using it?
I'm not exactly aware of what other departments are or are not doing. The state didn't communicate directly with me about it, and so I just have to make the best decision for the people of the city of Knoxville, and I don't take issue with what other districts are doing. That's their decision, but I feel it's in the best interest of the community to encourage everyone who can get tested to get tested, and this, I think, will build confidence and trust in that process.
Chief, what's the response of your officers then since they've learned that they will no longer get this information?
I'm sorry, what's the response?
Of your officers now that they'll no longer get this information?
Well, of course, we're disappointed. It was a tool that we believe in, but we have the commitment of the city to secure PPE for our officers, and so we're going to use, very similar to things that we've done in the past with AIDS patients, and use universal precautions as we come across anyone. So you'll see officers in gloves and masks, and we're going to do the best we can because, in the long run, it was my recommendation to the mayor yesterday as I weighed the benefits and the downsides. I still believe in having access to that list. I support the Tennessee Association of Chiefs of Police for other agencies to have access to that list. I think it's a huge benefit, but for our community, I think if it kept people from being tested, it was not worth it. We need to get people tested, and so then if they find out they do test positive, we hope that they heed that requirement that they self-quarantine. So that will help us as well if the people who are testing positive are self-quarantining.
And I know this is out in the future, but is there a timeline on how long you guys will be in full PPE gear?
Yeah, well, no, we don't have a timeline. We're watching just with everyone else, the ups and downs of, how many people are testing positive and how many aren't. We're in what's called level 1 of our law enforcement pandemic plan, and we'll remain in level 1 until we see some type of change. We are very fortunate. To this point, we've not had any officers test positive, so we are counting on being able to continue that.
Thank you. I just want to thank the mayor for making this decision. This was a huge point of contention as a negative deterrent for having people in the African American and underserved communities utilize the testing events that we've really been working hard to get in the communities. And so there are a collective of African American faith leaders who have been meeting on a weekly basis just to talk about COVID-19 testing, safety, and education in our communities. And so Pastor Smith is a part of that call, as well as Mr. Lomax. And we did bring our concerns to the mayor as well as the chief, and so I definitely appreciate their efforts. I am of the opinion that we should treat everyone as if they're positive for COVID-19, up to and including myself, because we all know that once you've been tested, science is now saying that you can be infected again. And so it's so important that we continue to push this initiative for everyone to be tested, especially in the African American community. Nationally, there are a lot of health disparities we see in larger cities where African Americans are disproportionately infected, actually even the death rate, the mortality rate in the African American communities. And so I applaud the effort. I do understand the concern, and I do understand why the database was going to be used. However, if it is going to deter people in the communities from being tested, it definitely, in my opinion, is something that we needed to put on hold or put a pause on to move forward. So thank you.
part that I would like to just to say to our chief and to our mayor is that as a community organizer is that we're making a deeper commitment to educate the community about how important testing is. That's the reason that we put together the Faith Leaders Coalition and working with all of our ministers and our pastors in our community. So what we're committing to you, Chief, and what we're committing to you, Mayor, is to do a aggressive outreach to our community to talk about the importance of wearing our masks, because when we wear a mask, we win. We all win. Our loved ones are taken care of, our children are taken care of, our senior citizens are taken care of. So we as a community organizers, advocates, we're making a deeper commitment to educate our community in regards to the importance of getting tested and all about this dreadful disease. So we thank you for all you do, Mayor, and we thank you, Chief, for all you do.